Hi friends, this is Dr. Jain. Today I am going to guide you on a different aspects of managing autism, traumatic brain injuries and especially neuropediatric rehabilitations. Okay, I am talking about a therapy called pulse electromagnetic field. Wonder therapy where it can be an adjunct to your treatment and practices. It can be one of the major streamline of treatment when you are working with special children, ADHD child, autism disturbances or any kind of spectrum disorders. You can use this technique. Now this PEMF therapy, it's not new to us. This has been there for so many years, okay, because pulsed, we are just electromagnetic field, we are just pulsating it, so it goes in a wave format. It's not a continuous exposure, so it is a non-invasive. It is very safe and no pain at all. The person or the baby or the patient have to just lie down on the bed. How does it work? It generates a low frequency magnetic field which can penetrate the tissues. I clearly says there is no side effects at all in this. These interacts with the cell at a cellular level and impacts this biological changes in the body. That is why PEMF therapy is excellent, can be a very beautiful tool. Now what is the neuro rehabilitation overview? You will scope of care, what is the care you can give, what is your team can do a different approach, what is your individualized treatment. This is how we plan it up when we handle our neuro rehabilitation cases. First, how do we improve your motor functions? Acupuncture, acupressure, stimulations, physiotherapy, various techniques are there to improve your motor function. Cognitive and social functions, behavioral techniques for cognitive understanding. There is a technique in the Kerala famous technique called Varmakalai that can work on the cognitive improvement. It should be a multidisciplinary approach, not one approach. We cannot stick on only to exercises, we cannot stick on only to speech, we cannot stick on only to this. So we need a multidisciplinary approach. But one question is, all the approaches really will be fruitful provided if there are some biological changes at cellular level within the body. That is where this PEMF therapy stands for. If it just sees in cerebral palsy, traumatic brain injuries or spinal cord injuries, okay, now what does it do? PEMF therapy. It improves your muscle function and coordination. It improves your circulation and oxygen delivery. It reduces inflammation and helps to manage the pain. And it improves the neuroplasticity. Very important concept called neuroplasticity, because brain has a tendency to adapt or to learn or to listen to various stimulus. So neuroplasticity is a major tool where the neuro rehabilitation department works on. How does it works? That is the main thing. How does a PEMF therapy work? It creates a cellular regenerations. When it imbibes the cells, it creates a cellular regeneration, which means what? It is going to prevent a cellular degenerations. Neuroplasticity, its ability for the brain to adapt and recognize the stimulus, this is improved. And the blood circulation, these three are the integral part in improving the functional activity of the brain. What is the limitation of our conventional therapy? We need to do an intensive approach, and the progress is, unless and until the body shows a progress, we won't be able to proceed further with the conventional approaches. So that is why PEMF therapy should be an integral part in managing your ADHD, autism or any kind of brain disorders. Now, what happens when you improve your neuroplasticity and a neural regeneration? PEMF therapy will do these things together. When the plasticity increases, it stimulates the growth and repair of the damaged nerves. And synaptic plasticity is new connection between the neurons. So these are all observed research which has been done by various neurosciences department. So when it improves your blood circulation and oxygen delivery, it creates vasodilatation and it improves your oxygen transport. These are the two major benefits. It reduces inflammation. How? When the circulation is increased, it reduces the inflammatory process, and this helps in managing your pain levels. And it improves muscle function and coordination. So when we do a PEMF therapy, PEMF improves the muscle strength and endurance, and it helps in the coordination activities also. So clinical evidences, there are plenty of clinical evidences are available online. You can just refer how does PEMF therapy can help your child too. Lot of effects been seen with the PEMF therapies before, after spinal cord injuries. Okay, patient selection and treatments are very important. The safety profile is considered very safe, but little precautions need to be taken. Contraindication, there is not as such, but implanted devices, open wounds and cancers active should be avoided. Monitoring, whenever we do the treatment, we do the monitoring part. So it is a right time when you can integrate PEMF therapy in your neuro departments with pediatric rehabilitations, where you can give a new approach, a new life to the patients. Take care. Bye bye.